Hello and welcome to All About Community. My name is Robert L. Harris and I am your host. Today my guest is Dr. Coynes Ennix, well-known physician right here in the Bay Area. Dr. Ennix, welcome to All About Community.
Thank you. It's a privilege to be here. Thank you.
Now, first let's talk a little bit about your background. You have
Sure.
an amazing background. Where were you born and raised?
I was born and raised in Nashville, Tennessee.
Nashville, Tennessee.
That's
All
right.
right. And did you go to school there?
Yes, I was born in what they called North Nashville, and luckily for me, that's where the schools of higher education were. I went to high school and college and medical school, all right there in my community.
All right there in Nashville, Tennessee.
That's right.
And that's where Meharry College is located.
Meharry Medical College, that's my alma mater. I completed Meharry Medical College. That's correct.
And you must have gone to that famous university, that Fisk University, did
Fisk.
you? Pray tell, you did.
Fisk
All right.
University,
Yeah,
the only in one.
All right. Now, how did you get interested in medicine?
Well, it's an interesting story. Actually, it had less to do with me and more to do with my environment. As I said, I was born and raised right there on the college campus, or right near the college campus, within a block or so of the college campus. And it was natural that I attended Fisk University. As a matter of fact, it's the only school I looked at. As I was
you didn't
finishing.
even think about anything else.
Didn't
other
think
than
about
Fisk
it.
University.
Only Fisk University, that's right. And I was guided there by my parents. And from there,
Now, were your parents in education?
my mother was a school teacher.
All right.
Yes, my mother taught elementary school, and my father was a lawyer.
I do recall that. And one of
that's
your
right.
brothers, if I recall correctly, is a lawyer.
Both of my brothers were
Both of your
lawyers.
brothers.
Both of
Oh,
my
wow.
brothers were lawyers.
And you went astray. How did you go astray?
I went astray. I guess I was interested in science and medicine from a very young age. I remember hearing the sirens on the way to the emergency room and meeting so many doctors. I had a lot of role models, and so it was a natural path for me to pursue medicine.
And you pursued medicine at Meharry Medical College.
That's right.
And then what happened after you graduated from college?
Well, I had
Medical college.
Yes. Well, I had a very circuitous and sometimes torturous route. I was married just prior to finishing medical school.
Uh-huh.
And my first stop was Detroit, Michigan, New York.
Wait, what do you mean your first stop? You just left medical school, got married, and then went to Detroit and New
Right.
York?
Well,
Got to be an explanation there
of course. My basic internship. They called it an internship in those days.
All right.
My internship was in Detroit, Michigan.
Okay.
The Sinai Hospital of Detroit. And from there, I went into a residency, as a matter of fact, right here in California, right here in Oakland, California, at Highland Hospital.
Highland, okay.
For a couple of years. And then I went from there to Cleveland, Ohio, New York, Texas, and a wide variety of other places before coming back to California.
And what was your specialty? Or what is your specialty?
Yes. Well, I'm semi-retired now, but I practiced cardiac and thoracic surgery for some 35 years. And as of today, I still go in once or twice a week to help my younger partners.
Well, that is fantastic. Now, what kind of surgery is that? What do they do?
Good question. A cardiothoracic surgery involves the heart and structures in the chest, the lung, the esophagus, primarily, but my specialty over the years has primarily been the heart and a wide variety of maladies that affect the heart.
And that relates to cardiology, is that right?
Yes. cardiology is related to cardiac surgery. Much of what we call workups or diagnostic maneuvers that lead to surgery are done by the cardiologist. And they turn the case over to us when it needs surgery. Now, of course, all cardiology problems don't need surgery. As a matter of fact, many or most cardiology problems don't need surgery.
But when
they do need surgery, then they turn them over to the cardiac surgeon.
They come to you. Now let's talk for a moment about some of the medical associations you've been associated
yes.
with. What about the Sinclair-Miller Medical Association?
Yes, it's interesting that you mentioned that. I was just speaking about that, the Sinclair-Miller Medical Association, to my wife this morning. I've been a member and have been a member of the Sinclair-Miller Medical Association probably for 30 or 35 years, and they've used me as a resource on issues of the heart and the cardiovascular system. I've given many lectures to them, to that group, and I've been a member of that group. My wife also was the executive director of the Sinclair-Miller Medical Association for some 15 to 20 years.
So you have roots in the Sinclair-Miller Medical Association.
Yes, yes.
Dr. Ennix,
Deep roots.
We are running out of time for this segment of
Sure.
the program, but we're going to have to go to break in a couple of minutes.
Of course.
Not in a couple of minutes, but in a couple of seconds.
Okay.
So don't touch that remote. We will be right back with All About Community. Again, my name is Robert L. Harris. I am your host, and my guest is Dr. Coynes Ennix, a noted physician right here in the Bay Area. We will be right back